we need to see that standard of care be legislated, and we want to see that implemented as quick as possible. Sadly, we're still seeing some horrible examples of lack of good care in long-term care homes. And it cannot be that what we witnessed in the pandemic, when people saw the conditions in Ontario and Quebec and some of the for-profit long-term care homes, some of the horrific things that we learned of, those cannot continue in our country. The fact that we, when compared to the rest of the world, had some of the worst outcomes for seniors in Canada, a G7 nation, which prides itself on our healthcare system, that simply can't continue. So our goal ultimately is that we no longer see seniors bearing the brunt of any sort of healthcare crisis. We want to see that seniors receive the best care possible. And so that's ultimately our goal. And we want to see the quickest implementation of the best qualities and best standards, best quality of care and best standards, so that we can prevent any losses moving forward. But we also want to make sure that it's not just the legislated standard of care, but also some of the things that I've outlined. We need to make sure that there's sufficient workers. And that means making sure we have good conditions of work and appropriate levels of hiring of nurses and other healthcare workers. And specifically, we also know that this government has promised, rightly so, but they haven't delivered on increasing the pay for long-term care workers to $25, as I mentioned earlier, and in addition to hiring a significant number of new long-term care workers, so that we have the sufficient number of workers that can work in one facility, not move between facilities, as one of the things that we learned was that moving between facilities resulted in disease spread. So there's some concrete steps that can be taken nationally to support better care and better outcomes for seniors, in addition to the standard of care.